Hello, how you guys doing? I'm really thrilled to be here again. It's really nice having you guys take our time to participate in this training webinar. So, I'm Dr. Ubong Udofia, a consultant psychiatrist, and my specialty is addiction psychiatry. And I'm very passionate about training healthcare professionals and other personnel on different aspects of addiction psychiatry. So, today we'll be talking about the relationship between goal setting and addictive behaviors. How setting goals the smart way will enable a person stay much longer in recovery and be free from the addiction. So, on the outline, we'll be taking you through the introduction. We'll look at goal setting, we'll look at addiction. Then we'll talk about the SMART goal. We'll look at the steps towards goal setting. Then we'll discuss real life documentation of patients' goal setting. That's the action plan. Then we'll discuss the concept of a goal misfire card. Then lastly, we'll now engage the participants in the activity of goal setting, where you'll be required to set your own goals using the goal template that we'll be discussing in the training. Now, a normal human being swings between two types of states or environments. The first state is a state of consumption, and the activities in this state or environment is purely driven by pleasure. There's always the temptation to keep wanting more. So in this slide, we see somebody eating burgers. The next slide, the person is doing alcohol, followed by sexual behaviors. Then there's betting, that's gambling. So all of these are pleasurable activities, and there is nothing wrong with wanting to seek pleasure. So the second state or environment, I like to call it the creation state. Now, the activities in this state are directed at physical, mental, and spiritual well-being. Also, activities would include service provision, having a job, being employed. So it's more of finding purpose or being functional. Now, what we have here, we have a guy working on his computer. We have a guy in nature. We have a lady doing biking, and we also have somebody planting. Yeah, and we have a lady who is, I guess she's caring for a poor child or somebody who is malnourished. And the last guy is meditating. So these are activities that are directed at sense of fulfillment, and it's perfectly normal to engage in the creation state, just like it is perfectly normal to engage in the consumption state. Okay, so in this slide, we're looking at the normal population, a population having active addiction, and a population that has finished or is in recovery. All right, this slide shows eight cycles, that each cycle has a white area, and let's call this white area the creation state or the creation environment. All right, and it also has a black area. Let's call this area the consumption state. Now, each of the circles has a different distribution of the black and white component. Each of the distribution of the black components represents a different amount of times a person would choose to spend in the consumption state, that is pleasure seeking, while the varying distribution of the white components represents the time spent in the creation state. Activities bordering around service provision like holding a job, as well as activities that border around physical, mental, and spiritual well-being. Now, all of these various white and black distribution are seen in a normal population. That means that some people may choose to have their life comprise majority of pleasure seeking and less of responsibilities. While another group might decide to have 50% pleasure seeking and 50% being in the creation state. And the third group may say, oh well, let me live most of my life in the creation state, doing activities like service provision, activities that are targeted at the physical, mental, and spiritual well-being, and then minority of pleasure seeking. It's important to mention at this point that each of the above choices are perfectly normal because there is still control. That is, they have the power of control in deciding when and where to abandon one state for the other. Now, the second rule describes the state of active addiction, where that control that the once had is gone. Now, in these cycles, you observe that there is no longer that distinction between both states, that is, both the state of creation and the state of consumption. The ability to allocate time for either state is lost. Now, in active addiction, the consumption state occupies the entire cycle with little streaks 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 little streaks of white state inside. This means that although they have lost control and that their entire life is spent in the consumption state, which is fueled by the addictive behavior or the addiction behavior, they will still need to tap into the creative states briefly just to get the resources which they need to sustain the consumption state. Maybe each trick might represent, let me go sell my dad's generator, let me go and sell this property. Or maybe they are showing up briefly at their job. Now, over time, they are unable to tap into the creative state as often as they used to, which is shown by a reduction in the number of tiny white circles. And this happens as the severity of the addiction increases. And it will show up as increasing loss of function. It's about 8 white circles. And as the addictive behavior gets more serious or severe, the white circles representing the creation state reduces. Now, the third stage represents a period of recovery, post addiction, in recovery. Now, after the individual has gone through the drug recovery program or is in the drug recovery program, as illustrated by these 3 circles, maybe he was kept in a church, or maybe he came to a hospital for a drug rehabilitation, he will at some point regain some level of control because there will be improvement in withdrawal symptoms, there will be improvement in craving, just because the brain has recovered after not being exposed to drugs for some time, which is what happens when they are undergoing detoxification. So the level of control increases the longer they stay away from drugs. I guess that's why most churches or rehab centers like to keep patients for longer periods in treatment. Nevertheless, no matter how long they stay in recovery, there will still be tracks or footprints of their addiction. 1, 2, 3. And these tracks or the footprints would remain because of the long-lasting changes that the addiction caused on the brain. Now, these permanent tracks or footprints left by the addiction, these are seen as these black lines that come out from the consumption state into the creative state. So these tracks confers a permanent risk of relapse or loss of control. That means that at any time, if nothing extra is done, they would still go back to the addiction phase and begin all over again. Now, what extra thing has to be done? The extra things that have to be done would be one to restore the creation states back to their life. That is the wide aspects. Then number 2, we want to maintain the states after restoration. Maintain the state such that the patient feels comfortable remaining in this state. And this usually occurs when the individual are exposed to activities that are either goal-driven and bring a sense of purpose. For example, activities that will target physical, mental, and spiritual wellness, as well as activities that target responsibilities or service production. Otherwise, if this is not done, the patients will naturally fall back into the consumption states where the addiction is. So the process of restoring or maintaining the creation states is made easier by goals, to be more specific, SMART goals. Let's talk about why having a goal. may not always ensure that you stay in recovery. While having a goal, usually you get to abandon the goal and just go back to your drug addiction behavior. So let's assume that the patient is taken to recovery and he has been there for 2 months. Then during one of the therapy sessions, they are asking the patient, what are your goals? Or while in recovery, he reminisces on his past and seeing that he has messed up his life and he now has a goal. I want to stop drugs. So, or maybe while he's having this goal, this is the goal represented by the idea, there are some things inside this, but it's not very clear. I can't even see what's inside it, but it's a goal. So maybe while he's in the drug recovery program, he's with other people and he gets to verbalize his goals. Maybe the therapist asks him, what is your goals? He now verbalizes it. Other people verbalize there, so there's some excitement, it's verbalized, there are questions asked. So in that state, there is more clarity, there is optimism. So this thought process goals is more clear than what we had in the first. So he had acquired a goal, he verbalized his goal to friends or people around, and it became clearer. His excitement and everything, and he really believes that he can make it this time. He's not going to go back to drugs. So after he leaves rehab, for example, he's alone. He has faced one or two obstacles along his path to recovery. It seems difficult. It's as if the goal didn't bring consideration that things would be this way. It's as if when he was conceptualizing the goal, he did not envisage that things would be this way. So he loses motivation, the brain power is unplugged, and everything that he had conceptualized just leaves his head. And it's like, let me just stop trying. So the brain power is turned off. He abandons his goals. He now reverts back to his previous default addictive behavior, and the cycle starts all over again. Let's look at the flip side. And this is all about written down goals. Is it different from the first part, verbalized or acquired goals? So the individual acquires a goal. This is the goal and idea. It's not clear. Yeah, it's not clear. Like he just acquired it. So the goal is to set his life straight during rehab or while he has engaged with the clean mind. The clean mind is a state of mind that reflects or reminisces on his past and says that I'm not going to go back. The clean mind is a mindset that happens when he's no longer influenced by the drugs, the withdrawal symptoms. So at about the 5th week of rehab stay or absence from drugs, he has a clean mind and he can think clearly. So during the states, he acquires a goal, and his goal is to set his life straight. Okay. Now he goes further to write down those goals. And he writes down these goals using a template, a specific template. The result is that it becomes easy to identify the support, the extra people that he would need, and have these people working for him and with him. The written down goal also highlights the obstacles. All right. And it's now a lot easier to carry out these goals without getting tired or discouraged. Okay, so we're in goal setting. So step 1 says identify a need. Where do goals come from? How can you acquire a goal? So when the individual has reached the clean mind, his mind is not influenced by drugs. He would either reminisce on his life. Wow, I've not held a job in a while. My family has a bad relationship with me currently, or maybe I have not done well in school and they want to do better. Maybe they want to meet these needs that they have observed using some ways. And one of these ways that they may have identified to eliminate these needs would be abstinence. So the abstinence becomes a first goal, and other goals would be maybe getting a job, fixing a relationship. So the first thing is to identify a need or a state of lack. Now, this happens when the individual is in the clean mind. Clean mind is a mind that happens when he's been free of drugs for like 4 weeks. In this state, the withdrawal symptoms or the craving is not influencing its decision making process. The brain has started the recovery process and it can now think clearly and regret his past or not. So at this position, he can now identify a need. Okay, I've not done well in school, I've fallen back in life, my family is having issues, I don't have a job. Now, when he has now identified this need, he now thinks of ways of meeting his needs. Another way to identify your need is to use psychosocial needs assessment interview, where the therapist talks with the patient, motivational interview style, and tries to bring out a need or create discrepancies. Another easier way is to use the value living questionnaire. This questionnaire can bring out a sense of lack of fulfillment. It's much easier to use the value living questionnaire than to do an interview. Now, after the interview or the value living questionnaire, a motivational interview can bring out the so-called needs he mentioned, such as not finishing school, can bring these needs into the limelight. So in the previous slide, I mentioned value living questionnaire, and I mentioned that it is part of need identification. It helps the person identify their needs easily. So this is a 10-item instrument that looks at different areas that are important to a patient life. The first is relationship with parents or siblings, there's spirituality, there's making money. So usually when one or more areas are not being met, there's usually a sense of fulfillment. So when this not meeting of an area is brought to the patient's awareness, the fulfillment or the unfulfillment or unhappiness that comes when you have observed these discrepancies can be described as a need, as we spoke. For example, not making money when he said money is important to him, or maybe poor relationship with his family after he said that family is important, or not even doing well in school. So they also have identified that one of the ways of coming out of this need is to pursue abstinence and abstinence goal. Other goals like getting a job, fixing relationship become their secondary goals. This is an assessment tool that we will use or that we're about to use to identify needs. So let's look at section 1. The 10 items on the list below show different areas of life that are valued by some people. We care about the areas that are important and a priority to you, your values. Rate the importance of each area to you by circling one of the numbers between 1 to 10 below. 10 means that this area is only 100% important. 5 means that this area is only 50% important. And 1 means that this area is only 10% important. So you rate each of the areas. This is relationship with parents or siblings, and the last is physical care, diet, exercise, and sleep. So give you 1 minute to do your rating, then we'll move to the next section. Okay, so by now we must have finished section 1. So section 2. In this section, we are interested in how you have been living your life in the past 3 months. We would like to know how successful you have been in living according to your values. Values are those areas that you said are important to you. Between 1 to 10, 10 means that I have performed excellently, 10 over 10 in this area. 5 means that I have performed averagely, 5 over 10 in this area. 1 means that I have performed very poorly, 1 over 10 in this area. What will you score yourself in each of the areas below in terms of, number 1, having a good relationship with your parents or siblings in the last 3 months. You now put a rating between 1 and 10. And the last is, how would you score yourself in each of the areas in terms of performing healthy activities, for example, exercising, eating healthy, good sleep in the last 3 months? So you have 1 minute to rate yourselves. You can pause the video at this point and finish the rating. All right, let's continue. There will be observed discrepancies between section 1 and section 2. The rating, how much important to you an area is versus how you have been living your life, there would always be a difference because everybody would not perform the same way. So there will be some differences. This discrepancy between section 1 and section 2 indicates a need. So it brings that need to the limelight, it brings that need to your awareness. And this need is the fuel for goal productions. So this need is where goals or inspiration of goals come from. So let me tell you a little story. It's a story taken from a very popular book. Right, this story is about a place or a thing called the Tower of Babel. So the community had been trying to build a tower, and in the end, were given different languages. So first of all, the community identified a need or a sense of lack, and they had the feeling that one, they are not popular, and then number two, very soon they will be scattered. So from that sense of need, they had to find a way out of this need. So what came to their mind was building a great city for ourselves with a tower that reaches the sky. So what you observe that this way of meeting the need was very specific. So a goal can only come when a need has been established. And it's also observed here that their need was relatable, as we'll understand in the next slide. So let's talk about what the structure of a written down goal should look like. The structure follows the SMART format. SMART: S is specific, M is measured, A is achievable or attainable, R is relevant, and T is time bound. Let's assume that somebody writes a goal. I want to go back to school. Should we write down this goal this way? No. Rather, it should be written down as a SMART goal. Let's go through what the word SMART means. So S is specific. Specific means that it targets a specific person, a specific place, a specific thing, or event. So it's very, very specific. It's being specific, directed at specific to a person, specific to a place, specific to an event. So you'll be asking these questions: can the current goal structure be broken down again into more specific or simpler formats? So in specific, he writes, I want to go back to school. It's quite vague, versus a SMART goal with the specific attributes. I have enrolled in the Department of Mass Communication in the University of Calabar. Is now more specific. The second part is measurable. So here, can the goal be measured? Does it have qualities that you would know that you are achieving it? Okay. Let's assume a goal is I want to have peace in my family. Can you measure peace? Not really. So the individual now makes the goal more SMART, measurable. I want the quarrels between me and my wife to reduce. Now this is more measurable. Now the A is achievable. Okay, this means that it is slightly out of your reach, but not impossible. It's slightly out of your reach to make it challenging, but not impossible to avoid discouragement. Let's look at an example for attainable or achievable. So I want to make 300,000 naira monthly versus I want to make $100,000 monthly. Another way to know if a goal is achievable or attainable is that the steps that you would need to get it done is known. The steps or the habit that you need to achieve this goal is known. If the steps are not known, the goal would still belong in the realm of fantasy or the realm of dreams, and we don't want it that way. All right, so R is relevant. Relevant means that the goal is important to a person's values, it's important to a person's ambition, it's important to a person's future that is relevant or relatable. Then T is time bound. The goal should have a delivery date. Okay, so without a delivery date, there will be no motivation. So the goals should be written in the present tense and not the future tense. Present tense has a way of eliminating procrastination. Okay, so this is the goal worksheet. There are 4 goal sheets in total. It's basically the same thing. The first goal sheet is for 12 months. The next goal sheet is for 12 weeks, followed by 1 week, and followed by tomorrow's goals. So each goal worksheet has the first component is my goals during the next 12 months are. The next component is the most important reasons why I want to achieve these goals are. The steps I am taking, the habits I am forming that is giving me my goals are. Some obstacles, for example, myself, sad, anxious, stress, discomfort, my friends, my environment, my finances, that will prevent me from my goals are. Then lastly, the things I would do to reward myself after achieving my goals are. So this is the goal worksheet. The aim is that you are breaking down the 12 months goal into a 12 weeks goal, and you'll be breaking down the 12 weeks goal into a 1 week goal, and you'll be breaking down the 1 week goal into a 1 day or a tomorrow goal. The aim is to reduce that 5 kilometer distance into a 1 kilometer distance, into a 500 meter distance, into a 1 meter distance to make it look easy and more in the present. Okay, so we are looking at the different components of the goal worksheet. We're starting with a 12 months goal worksheet. The first item on the list is my goals during the next 12 months are. So this is long-term goals. It can be 1 year, it can be 2 years, it can be 3 years, but it's long-term goals. So what do you write in the long-term goals? You're writing a goal statement. The goal statement is a SMART goal statement that we develop from the ordinary goal. So what we would have here is that the goal statement would have the specific and the time-bound qualities of a SMART goal present, and it would be written in the present tense. It will be explained later. Now, the next component is the most important reasons why I want to achieve this goal. Now, emphasis on most important, not just important reasons. So if somebody says the most important reason why I want a job is to get money. Now, getting money is important, but it's not the most important reasons. That money that you want to get will be used for something. For example, I need that money to provide for my family, or maybe I want that good feeling that comes with being able to provide. So it's those very important reasons that will be your motivation or the core reasons that you will want to use to chase the goals. So this is an example where a patient's 12 months goal was put into the goal worksheet. So my goals during the next 12 months. Initially, he said, I want to go back to school. So this was now converted into a SMART goal, and SMART goals would have the specific components and then the time-bound component. So he broke down, I want to go back to school. He broke down school to University of Calabar, Department of Mass Comm. That's the specific component and the time-bound component. And the third part is that it had to be in present tense. So he's not saying I want to secure admission. It says I have secured admission. The thing about present tense is that it makes that goal more in the present. So the risk of procrastination of things you're supposed to do to get the goal is reduced than if you are telling yourself, okay, I want to secure admission. Okay. Then the next part is the most important reasons why I want to achieve this goal. Now, there are a couple of reasons. I am young, I did not finish school, I will be prepared for life and feel accomplished. I want a civil service job. All right. So, reason two, and maybe reason three seem to be very important. Reason one is important, but why does he want this job? So in as much as he's saying that he wants to go to school because he wants a job, he's not telling us why he wants a job. So is there any way that you can make these reasons more specific? That's the task. So let's look at how we can make these reasons more specific. Maybe you pause the video and then see how you can make the reasons more specific. So we're now in the third part of the 12-month goal worksheet, the steps I am taking, the habits I am forming that is getting me my goals. The question here is, what are you doing What are you doing that is getting you your goals? Like I explained, this is going to be written in the present tense to discourage procrastination. So the steps he is taking, the habit he is forming that is getting him the goals. So if you observe below, it tells what things are you going to be doing, what steps. So this answers the A part of the SMART goal: achievable. S was specific, M was measurable, A was attainable or achievable. Okay, what steps to know if a goal is achievable? That is, you're taking it out of that fantasy or dream state into reality. You need to know what you have to do. So the patient observed he needed to do four things. First was to register for JAM exams, to register for JAM lessons, to attend JAM lessons consistently, and to write the JAM exams. The goal of being in Unicalm mass comm department, he knows the steps he needs to take. So by knowing the steps he needs to take, he has pushed the goal from the realm of fantasy to reality. All right. So as long as the person doesn't have any thoughts or answers about the steps he's going to be taking to get the goal is unattainable. Once he can get an answer, once he can get thoughts regarding what he has to do to get it, it has now moved to the realm of reality or being attainable. Now, this step is easier and faster if you have a friend or someone to help with the brainstorming process. Now, sometimes the steps you need to take might not really be in your present awareness. You might need to ask a friend, do some researches before the step comes. Okay, this is the fourth component of the 12-month goal worksheet. Some obstacles, example myself, sadness, anxious, stress, discomfort, my friends, my finances that will prevent me from my goals are. Now, this is you scanning your past memories. What about myself? What about myself? Maybe sadness, maybe anger in the past has kept me from my goals. What about myself can keep me from my goals? So you ask yourself, have my emotions or feeling distressed ever caused me to give up on any of my past goals? You would ask yourself that question to discover anything about yourself that has kept you in the past from goals that were closely related to what you are chasing now. Now, you also ask yourself, friends, maybe a neighbor, acquaintance, or even a business partner or a business colleague. Now, in answering these questions, you are going to be writing the specific names of these people in your past that has made you derail from a closely related goal, or people in your present that can make you abandon the daily activities or the daily actions that is getting you your goal. You need to write down their specific name. So it's more than just writing neighbor, friend. So let's give ourselves a small task. This guy wrote 4 obstacles. Can anybody point out which of the obstacles are personal obstacles? Obstacles relating to himself among these 4 reasons? All right. Then the second task would be, can anybody identify any other personal factor aside the one mentioned here that can derail people from their goals? So write your answers in the comments. Okay. This particular slide has 2 aspects. We are continuing with the obstacles. We discussed personal obstacles, friendship. Friends is an obstacle. We're now looking at the environment. Okay. So what in the environment, your environment has made you abandon your goals in the past? What in your environment can make you abandon your current goals? So you're looking at a lack of or the presence of something that is not allowing your goals actualize. Or what things do you need to, or the things that keep taking you away from the steps you are taking or the habits that is getting you your goals. So you're looking at maybe financial unavailability, poor social or recovery network, absence of a human support structure in the environment. So you need to write down the things to remove from the environment to make it easier to carry out the habit or the steps that is getting your goals. Now, the last component of the 12-month goal worksheet: reward. Things I would do to reward myself after achieving my goals are. Remember that habits are motivated by reward. Someone is seeking pleasure. Pleasure itself is the reward. So if you're seeking a creation state activity that builds fulfillment, it's okay to create an artificial reward. This reward would tell your brain subconsciously that this is a good thing to chase. So what you're looking at is, how will you reward yourself to mark any progress, or what will you deny yourself until you achieve your goal? So we're done with the long-term 12-month goal worksheet. We are now taking that long-term goal, breaking it into a short-term goal. I explained that the 12-week goal section has exactly the same components as the 12-month goal. The first is my goal during the next 12 weeks. So what goal statement are you going to write here? Now, you are basically lifting two things from the 12-month section. The first thing you're going to be lifting is the steps that you were taking in the 12-month section that was going to get you at your 12-month goal. You're bringing those steps and putting it here. Number two, the obstacle that you observed in the 12 months section that would have kept you from getting your 12 months goal. You're taking that obstacle, but this time you are rearranging the words. You are now addressing or overcoming that obstacle you identified in the 12 months section. For example, an obstacle was my friend Ipeon. So the goal would be to get rid of Ipeon by June 2024. That will be the goal statement. The third thing, or the third goal statement you will be putting in the 12-week goal would be maybe entirely new and separate mid-term to short-term goals that are not related to the initial breakdown of the 12 months goal. So the 12 months goal was, I want to go back to school, or I am in school by June 2024, and that was the goal. Now, this person has a short-term goal. Let's say I want to increase my spirituality within the next 1 month. Now, this is a short-term goal. It's not as long-term as I want to go back to school, and it is totally unrelated to the goal of going back to school. So it's going to be put in the 12-week section as a goal statement, totally separate from the breakdowns of the past. So you're going to be repeating the same process that you did for the 12-month section, the most important reasons. So the other components, such as the steps I am taking that is getting me my goal, the obstacles, the rewards, will follow the same process as we discussed in the 12-month section. Okay, so this is a sample of how we moved from the 12-month goal, 12-month long-term goal, to the 12-week long-term goal. We are comparing the goal statement in the 12-month goal and the goal statement in the 12-week goal. Let's look at this example. I have secured admission in the University of Calabar, Department of Mass Comm by June 2024. The steps he needed to take was register for JAM lessons, attend JAM lessons consistently, write JAM exams. Now, all of these steps are now taken to be goals for the 12 weeks. So he broke them down into 12 weeks, 12 weeks, and 12 weeks short-term goal. So register for JAM exams, register for JAM classes, start JAM classes. All right, let's pause there. Now, some obstacles that he observed in the 12-month section was lack of funds for registration, not getting the required cutoff mark, and Okon, my neighbor who I smoke with, might lead me astray. So addressing these obstacles now becomes the goal of the 12 weeks. All right, so let's see. Break contact with Okon. He identified Okon as an obstacle. So to address this obstacle, he needed to break contact with Okon, which is now the fourth goal. Then surround myself with what would motivate me. This addresses the obstacle indicated in number 4. I want us to address another component in the 12-week worksheet that may cause some confusion, and that is the most important reason why I want to achieve these goals are. Now, it's possible that the reasons that you highlighted in the 12-month section might be the same one you want to write down there. Very correct. Or maybe there might be new reasons. But now, if they are the former reasons you put in the 12-month section, you need to rephrase them. You need to rephrase those reasons. Let's look at an example. So the person in the 12-month section wrote that a reason I want to achieve my 12 months goal was because I want to be able to provide for my family. Now, it was the same reason that he thought about in the 12-week section. So he now rephrased it. That feeling of being the man of the house and having my family look up to me, knowing I would meet their needs, it's something I want to experience. It's the same meaning, the same reason, but it's rephrased. So then number two, you would now put new reasons. So when you're shifting from the 12 week to 1 week, from 1 week to tomorrow or 1 day goals, it means that you would have to rephrase three times. Three times. So the first rephrase is when you moved from your 12 months to your 12 week. The second rephrase of the reasons will be moving from your 12 week to your 1 week. And the third rephrase will be moving from your 1 week to your tomorrow's goals. Okay, so we have come to the last step in the goal setting plan. Now, this is the concept I mentioned earlier on, the goal misfire card. What if I don't get to my goal? That's the question. Now, this particular card or session does two things. It reinforces consolidation and motivation. This card is simply a tool that allows a patient to revisit their goals, consolidate their goal plans. Now, this card is best administered 1 to 2 weeks after goal setting. Enough time must have elapsed for them to have let go of that initial excitement. And the style is interview style, question and answers. So you ask the question, what is my goal? He answers. You ask another question, why is this goal important to me? He answers. Now it's important to state that they're not allowed to look at their goal worksheets. So these answers are coming from their head. If they make mistakes, you can assist them as the case manager or as a friend who is helping them make the goals. Or the card can be used by the index person who is setting the goals. You check what his goals are. So on answering the question, what is my goal? If he cannot remember how the goal was framed, he's allowed to look at the goal worksheet. But he should try to answer all those questions without looking at the goal worksheet. Now, this will be done for each of the goals he documented in the goal worksheet. Number 7 is very important. Specific thing will I do to get back to my goal when this obstacle happened? Now, this looks out for if the patient has a coping strategy when he faces challenges or obstacles. If there is no cope ahead plan, the case manager should assist in coming up with one. If this goal setting is done by an index person without any help, he should check for the presence of a cope ahead plan. Maybe I face this obstacle tomorrow, what do I do? So the plan should be written down. This is now done for every goals that were indicated in the worksheet. All right, so we've come to the end of this training. My final words, I love to describe using pictures. So this black barrier separates the consumption states of which the addictive behavior comprises of, and then the creation state, the purpose-driven activities, just being able to function. So this barrier separated. Now, goals make it easier for the individual to be in recovery, to be functioning, to pursue his purpose. Goals make it a lot easier. There is no effort from the consumption state because the individual will naturally gravitate towards consumption state if the creation states no longer exist. So goals help with the maintaining of the creation state. Goals help with the maintaining of recovery. So we are now going to be doing the activity where each of the participants will be given a goal template, the goal worksheet from the 12 months to the tomorrow's goal. So you'll be required to write down your goals, break it down as I explained during the training, and then we're now going to look at each of them. Let's give ourselves maybe 30 minutes to conclude. Meanwhile, thank you for staying with us from the beginning to the end of the training. Please feel free to drop your questions or your comments. Until next time.